So as we mentioned earlier on, that the Egyptian government recently started clinical trials for local coronavirus vaccine. Now, the World Health Organization says Omicron has been detected in 38 countries, but there are no reported deaths so far from the new COVID-19 variant. The president of the International Federation of Red Cross and Red Crescent Societies, meanwhile, says the scientific community had warned the international community on several occasions about the risks of very new variants in places where there is a very low rate of vaccinations. Now, about 65% of people in high-income countries have had at least one dose of vaccine against the coronavirus, but just over 7% in low-income countries. For some analysis on the latest developments around vaccine inequity and the politics around the production of a patent-free vaccine, we're joined now by Professor Christian Happi, who is the director of the African Center for Excellence in Genomics and Infectious Diseases. A very good evening to you, Professor. Thank you so much for speaking to us. So, some interesting developments, as we just mentioned there, that Egypt has already begun the process of clinical trials. Talk to us about the work that you've done. And before we actually get to that, perhaps we should start with what the scientific community is saying around Omicron and what it means for future innovation on this end of vaccine development.
Well, I mean, what the scientific community is saying, first of all, thank you for having me on your program. But what the scientific community is saying is that we got to be more cooperative and we got to be more transparent. If we had shared the vaccines equitably, and if everybody in the world was vaccinated at the level where the developed world was, we definitely wouldn't have seen probably the emergence of of Omicron, variant. This is what we've been saying for the past 1 year, that as long as, we have, COVID transmission going on, no matter how far the place is, there is a possibility of the emergence of new variant. And then today we're experiencing that. And I hope that this sends really a strong signal to the international community so that we can all come together and cooperate and ensure that people get vaccinated and then make vaccines available to, everybody, or especially to the countries in the developing part of the world, and avoid this kind of repeat. Because if transmission keeps going and if lessons are not learned from the emergence of Omicron, we're very concerned that, in the future, we may even have a variant that will be more dangerous than Omicron. Therefore, we should be very careful.
I think it's an indictment on multilateralism, as I mentioned, that only 7% of low-income countries have had access to vaccines. And the whole point of it is the work that you've been doing on patent-free vaccines. Talk to us about what you had done in, was it 2020, at the African Center for Excellence and Genomics and Infectious Diseases. You've been developing a COVID-19 vaccine and passing preclinical trials?
Well, we really moved very fast in 2020, and then by September 2020, we had a candidate vaccine that had undergone, preclinical trial, and then since then we were pretty much stopped. Stopped in the sense that, nobody believed and then had confidence in the fact that we could actually push a vaccine out there that could be as good as what is presently available. And it's really, for me, it's very pathetic for Africa, because we had an opportunity as a continent to actually leverage such technology and then such vaccine in order to actually develop something that Africa could actually use and also provide Africa a voice at the table. Right now, we are again at the receiving end. We're going to be seeing, a potential development of vaccines against this Omicron variant. You mentioned Egypt starting a clinical trial, but then the question is, where is the origin of that vaccine? Is it that vaccine that is really developed, with Africans? And as long as Africa does not really bring the resources together and bring its brains together and invest where the brain and the mouth is to develop a vaccine and then set up a platform for not only for COVID vaccine, but future vaccine development, we're always going to be in a situation where we are begging. And we even see the worst of it, which is even when we have the resources, we are not begging anymore. We have the resources to buy, but even at this point, they tell us that even with your money to buy, there's none for you. So I think, it is time for the continent to actually to close the ranks and then come together and then decide exactly what our future holds. Africa futures is intricately related to, to R&D and especially to infectious diseases. I think this is a unique opportunity for this continent to come together and then say enough is enough.
And this is what boggles the mind from what you're saying, Professor. You had 90% effectiveness in terms of this vaccine developed against the first and second variants of the coronavirus on animals. Why was Africa, let's take the African Union, for instance, in their vaccine development strategy, why were they unable to convince countries or even donors to pool resources to bring about the money that is needed for the development of an African vaccine that would be freely available to Africans?
I think it's a cultural thing for Africa to be actually in a situation where we're begging. And I think, we have to learn from this pandemic and then get rid of that kind of mentality and then start thinking about developing things ourselves. If you look, we're talking about Africa. Africa has developed even less than 1% of the vaccine that actually produced less than 1% of the vaccine that we use. So, of course, you should understand it is lack of investment and also even lack of foresight in the sense that, we have, about 70% of the disease of the pathogens that have pandemic potential. And I see no reason why Africa shouldn't leverage such rich biodiversity to be the world leader in producing not only vaccines, but diagnostics and even therapeutics. And really it's a lack of foresight. And I want to believe that, with this call, with COVID, and then the new call for African leadership, there is a need now to actually think about really, taking Africa, rightly deserved position, which is actually being the driver of innovation and creativity in the field of infectious disease, and we definitely have to do that. The reason why Africa refused to invest, I don't know, but I think it's actually part of that, what I call the colonial mentality that we have, that the best is always going to come from the West. And it's a shame that, we find ourselves in this situation.
The work that you've done in the field of genomics and tracking these infectious diseases, you spoke about unique situations earlier on, and I know the WHO Africa region had said from the get-go that just even in modeling, when you look at how COVID-19 has struck the countries in the north and how it's been different for Africa, talk to us about how we could use that to our advantage. You said we have a wealth of biodiversity as well. How would we use those facts and that wealth in biodiversity to develop our own vaccines?
Well, I think it's all about investment and then actually setting the priorities. I think we should basically invest where our mouth and our brain is. And then definitely Africa has what it takes to develop its own vaccine. Look at the African diaspora. Look at those in the African continent. It's all about harnessing the resources, both human and then financial resources. Where is the African private sector that can, take such innovations and then drive it to a point where we can actually produce? Where is the leadership? Where is the leadership when it comes to the public health on the continent, whereby we would think that, the leadership that is really residing in the hands of our heads of state, we think about, taking advantage of the skills and the knowledge that is available, both within the continent and in the African diaspora. Bring the brains of Africa together and then tell them and task them and give them a mandate, to move, this continent forward. But unfortunately, we are all stuck in this whole colonial attitude whereby it is practically impossible. Tell me, how do we get a vaccine done? If you want to bring an expert from South Africa, an expert from Morocco, an expert from Rwanda and then Nigeria together, how do you do that when it is practically impossible to move around, when it's practically impossible for Africans to gather together because of all of this restriction that we have in terms of not travel restriction, but we're talking about immigration restriction. So, there is no brain circulation on this continent. And then we need to break down these silos and break down all these barriers and then enable people to bring, the brains and then the resources together and then move this continent forward. You can't make progress if there is no knowledge of brain circulation. I think these are some of the things. We're talking about Vision 2063, and yet it's almost impossible to circulate on this continent. It's almost impossible to move around. And the question I ask often is, if you cannot move banana from country A to country B, is it a vaccine that you're going to be moving from country A to country B? You know what? The agenda of 2063 for the African Union should have started many years ago. Break down these silos and bring people together. Invest. We talk about 15%, the Abuja Declaration. How many African countries are meeting this declaration? None. So we should basically just continue. Let's stop this slogan. Let's stop making a lot of rhetoric. Let's put action. Let's be actionable. Let's have more action than talk.
You're raising some very important questions, and I hope we'll bring you back to explore them further. Really appreciate your time and your insights. Professor Christian Happi there is the director of the African Center for Excellence in Genomics and Infectious Diseases. Well, that's it for this hour.